Dr. Sakina Davis.
Hi, I'm Lori Rhemann, physician assistant.
And today we're going to talk about all things thyroid on Wellness Wednesday.
So, Dr. Davis, can you just give me some examples of typical symptoms of underactive thyroid?
Sure. So some of the most common symptoms we see include weight gain, fatigue, constipation, dry skin, hair loss, feeling achy and tired, joint aches, feeling numbness in your fingers and your toes. And then some people actually lose the outer third of their eyebrow, which is a really interesting symptom that we see.
Can you tell me a little bit about the testing that you do for hypothyroidism?
Yes, so we do more extensive testing here. We're going to look really in depth into your thyroid, look at, first of all, if you have any autoimmune thyroid issues. We look at the function of your thyroid, all of your free hormone levels, and really based on that determine really what's the best appropriate treatment for you.
So what type of treatments do we offer here?
So we offer more of a combined treatment using combination treatments of the hormones T4 and T3, which are unlike a lot of the conventional treatments using Levoxyl, Synthroid, or levothyroxine, the generic. So we're able to really see which one is most important for you and determine if we need to do a compounded T4, T3 supplement, a compounded porcine thyroid, or one of the commercially available Armour Thyroid Nature Throids. But these are more complete medications that really address and treat the symptoms more so than the generic sort of versions of the T4 only medications.
Can you tell me more about Hashimoto's?
Sure. So Hashimoto's is an autoimmune condition that we see passed down in families, and it's really related to inflammation. So when we address what Hashimoto's is with our patients, we really need to talk first and foremost, like what is causing this inflammation. So we look at nutrition, we look at supplement deficiencies, which is what we have some examples of here, and then decide if we need to address the inflammation first, or do we need to also address the thyroid function, or do we address both? So by looking at Hashimoto's, we're able to really determine more so how we can completely treat the thyroid and really get them to feeling much better than if we only address the thyroid function by itself.
Great. What are some of the other treatments for Hashimoto's?
So in addition to obviously treating lifestyle and nutrition, we also look at using something called low-dose naltrexone. So low-dose naltrexone is a medication that's compounded, that's used to help other autoimmune conditions, but also can help reduce the inflammation and the antibody levels that we find associated with Hashimoto's.
Great. We actually are attaching a link to Magnolia Pharmacy's virtual presentation tonight about low-dose naltrexone, and that is from 6 to 8 p.m.
And then we also can use CBD because we have some examples of that as well, which is also very helpful to reduce inflammation. So our whole goal is to really find out how we can best completely address your thyroid by looking at inflammation, if that's part of it, and then looking at using the correct medication for you. So I hope that was helpful.
That is all great information. Thank you.
Great. Thanks for tuning in today.